So do surgical scars disappear? No, they don't. They do fade with time, however, provided you take care of them properly. In the initial instance, the scar can be very obvious and dark and purple, usually around the 1 to 2 week mark. After 2 to 3 weeks, you'll notice the scar scab up and becomes dry. It's at this point that you can start massaging the scar in deep circular motions like this. If you do this 2 to 3 times a day, around 1 to 2 minutes each time, what it will help do is help soften the scar and keep it soft. You don't have to use anything expensive, there's lots of recommendations, but as long as it's nice and moist and it doesn't irritate you, it should do the job. During the healing process, keep an eye out for an infection. The signs of infection include tenderness at a point where everything is healing fine and suddenly it starts to get painful, and you may notice some redness spreading around the wound. If this happens, you need to consult your doctor. This needs to be treated appropriately with antibiotics and dressings. Once it's healed and scabbed over again, you start the massaging process. Around the 2 to 3 months time, you may notice the scar follow various different paths. There are different ways the scar can heal. You can have a well-healed scar. You can have stretch scar, which can particularly happen in areas of movement such as the arm or the leg, or you can start developing a lumpy scar. Now this can be mild, known as hypertrophic scarring, or it can be quite severe, where it's known as keloid scarring or lumpy scarring. If you notice it's starting to get lumpy, I would recommend you consult your plastic surgeon, because there are a variety of methods that can help reduce the lumpiness and soften the scar again. This includes silicone gel pads and steroid injections, but have a chat with your surgeon.